Today I'd like to explore the connection between asthma, the illness of asthma, and systemic racism, and see what the connection between the two might be and how we can address that connection. 145 children died of asthma in 2021. But it's interesting that 3 in 4 of those children who passed away were either Black or Hispanic. We look at that problem here in the suburb of Long Island, outside of New York City, and it seems to be hidden for us among the generally affluent population. Wyandanch, which is a predominantly Black and brown town, has some of the highest rates of asthma and the highest rate of pediatric asthma emergencies on Long Island. So again, this gives us a clue. Why is this a problem, more of a problem, in certain communities and not in other communities? And what does this tell us about how we approach this problem? 5 million U.S. children with asthma, and the poorest households, when that figure of 5 million is examined, the poorest households have an asthma rate which is 1.5 times higher than those in the highest income households, according to the Centers for Disease Control and Prevention. Non-Hispanic Black children have higher rates than non-Hispanic white children. Again, we would just take a look at something like that and say, why is that so? Is there something to this that we have to look at a little bit further? Basically, one of the things that we examine with regard to asthma are the triggers. What would cause it? And some of the common asthma triggers are cockroaches, dust mites, and mold. And to eliminate those is very difficult in low-income housing. So we can see, well, maybe there's a connection between low-income housing and the conditions therein and asthma. Now, we have effective medications to control asthma. It's an illness that has been well researched, easily diagnosed, and so there is help available. But uninsured and underinsured families struggle to pay for those medications. And also, not only the medications, but for the accompanying medical visits to go to a medical provider to get the help, the diagnosis, the help, the prescriptions that are necessary. So some might say, well, not really a problem for low-income people because they're covered, aren't they, mostly by Medicaid? Although that would be true in some states, not in other states. And in many states, the number of those that have been insured under Medicaid during the pandemic, that health emergency, are now rising because the emergency is, for the most part, over, although, of course, COVID is still prevalent. Now, with the children covered by Medicaid, 42% fewer outpatient visits and 48% more emergency department visits, and a 20% increase in hospitalization. So they have the Medicaid, but not so much to cover the outpatient visits, but it seems to be more utilized in emergency room situations and hospitalizations. That is Medicaid data from the Journal of Pediatric Healthcare. So again, maybe having the coverage, but still, what's happening here is that they're going to emergency rooms at a much higher rate, and they're hospitalized at a significantly higher rate. One of the things that's associated with a decrease in asthma is an increase in home ownership, and also a decrease in asthma-related emergency department visits when you own a home. But black populations own homes less than white populations. 42% of the black population owns a home, 73% of the white population. So again, you'd say that's a significant difference. Schools in communities of color are nearly 4 times more likely than those in predominantly white neighborhoods to be near factories and also major roadways that can spew asthma-triggering pollutants from their vehicles. Particularly, you have trucks and diesel vehicles, which would be spewing things that are more harmful to the air and would affect those with asthma at a much more significant rate. Students attending schools farther from major roads are less likely to report asthma symptoms, 29% less likely, and also poor asthma control, 20% more likely. So we can see that even significant distance from major roads plays as a factor into the asthma situation. So from all these figures and this analysis, one of the conclusions we could draw is that systemic racism and structural inequities lead to poor health. And some people, when that term systemic racism is used, it kind of rubs them the wrong way. What do you mean systemic racism? You know, I'm a nice person, pay my taxes, treat everyone fairly, love everyone. I'm not creating any sort of system about racism, just the opposite. I'm trying to do everything to promote fairness, equality, love of neighbor. How dare you call me a systemic racist or say I'm involved in systemic racism? Yeah, it's not me. I don't follow that path. You know? And you can understand most people certainly don't think of themselves as involved in a systemic racist system. They think they live in a fairly nice country, promotes a lot of equality for all, been a lot of progress made, a lot of laws passed, things are going in the right direction. What do you mean systemic racism and structural inequities? Well, as the statistics point out, why is it that people of a certain color are harmed more by this illness? You wonder. So you look at some of the factors, and it seems to be that there are things with regard to the environment. If you live near a factory, or if you live near a garbage landfill or garbage burning facility, or if you live near a major highway that has a lot of diesel traffic on it, you're going to be more likely to pick up this illness. And then you look at the demographics of those areas, and you say, well, those areas are primarily more black areas, Hispanic areas. They seem to suffer more from the illness. So why is it that our particular system is structured in this way? That people seem to live closer to those more undesirable and harmful areas. Well, we have to take a look at that and say, maybe we should change that a bit. Huh? And if we look at housing, we say, well, this illness is related to qualities of your housing. If there is more mold or more cockroaches and mites and rodents. And it's going to have an effect, you know. So maybe we have to look at that particular issue. As to why is it that people of a certain color seem to live more in those homes? You know, and just say, well, is there anything we can do about that to change that particular system? And the other thing is, of course, people getting access to the health care that they need. We say, well, they have certain coverage and it's, fairly good, but then, well, wait a minute. It doesn't seem that that particular coverage is reducing the problem. It seems that the statistics are all saying that, well, wait a minute, there's still an issue here, and more emergency room visits, more hospitalizations, people of a certain color. What's going on here? So we use that term systemic racism. It's not about anything that a certain individual might have done or is promoting, saying, well, I want to be a racist. I want to make sure that, more black people get asthma than white people. And no one is certainly taking that route. We're saying that there are certain tendencies and structures in our society that seem to promote this illness in a certain population. And so let's take a look at that. Let's, take a look at the reality, the statistics, and what can we do about it. So in terms of a strategy, because it's always good when you have an issue of justice, an issue of disparities, to say, well, is there something I can do about this? That we can do as a society to help with this issue, to make this issue, break down and minimize it, and hopefully one day even perhaps eliminate it for people. Is there anything we can do about that? Any steps we can take? It's not that we're powerless in terms of these issues. We have the ability to make change. Some people are like, well, it's always been that way. It's always going to be that way. And you can understand, people get used to a certain, well, certain people live in bad housing. They're always going to live in bad housing. We get used to those things. We take a look at it, step back and say, well, can we change that? Sometimes, again, we're always blaming the people who are the victims, saying it's their fault. But maybe let's take a look at it and say, well, what can be done to eliminate some of those things? And of course, many people are working to do that. It's not something that is just newly discovered. Many people are aware of it and trying to eliminate it. So what are the three main strategies to work on this issue? And I think they're really good strategies. The first is to promote environmental justice. Certainly, many are very well aware of the environmental problems. Many are working to change them to make our air better, to make our water supplies much purer, and to make our soil cleaner and less polluted. And certainly to work in environmental justice is a sense of, well, we should do this for certainly everyone. And if there is a certain segment of the population that is more affected by these issues and these realities, let's work against that. And I think that seems pretty logical and fair to all. So with the system of putting certain people in certain neighborhoods that have a lot of pollution, well, let's eliminate that pollution. Let's work to make those neighborhoods better, cleaner, safer for all. No matter what the race, no matter what the nationality, no matter what the background, no matter what the religion, let's make it safer for all. That seems to be kind of a common sense approach that we can break that system down, can't we? And make our air better, our water better, our soil pure. Second strategy is to improve the quality of housing, which of course is a wonderful project for all of us to look around and say, well, what can we do about the housing in our area to make it more affordable, to make it cleaner, to make it healthier for people. So if there is housing that is substandard, where there are problems with the mites and the cockroaches and the mold, uh, those types of issues that can lead to more asthma, what can we do to make that housing stock better, to improve the quality of it for everyone? And certainly improving our housing system and eliminating any elements of racism in it is a good thing, a wonderful thing, and wonderful for everyone. And the third strategy is to increase access to quality health care. So if the medications are available, to make sure that you can work with people to make them affordable for all, certainly important. To minimize the emergency room visits by providing access to good primary care, physicians, making sure that's available for people, and in every way to cut down on hospitalizations by, again, getting the medication and getting the healthy living conditions and healthy environment, all of those things working together. So when we hear about this, asthma and systemic racism, again, our first reaction might be, well, I'm no systemic racist. I'm a good guy. I'm a good person. I try my best. And certainly that is true. But also true that a lot of our systems, unfortunately, that have been in existence have defects in them. And we have to analyze them with clear eyes and a clear vision and work out a fair and a just strategy to eliminate those inequities. And it can be done, has been done in many communities, continues to be a priority, and certainly something that will benefit many, many people.